This video is on coronary artery disease, a condition that impacts millions globally, and it is the leading cause of death worldwide, responsible for approximately 17.9 million deaths each year. It occurs when the major blood vessels that supply blood to the heart become narrowed or blocked due to plaque buildup, a condition called atherosclerosis. Coronary artery disease develops when fatty deposits, composed of cholesterol, fats, calcium, and other substances, accumulate along the walls of the coronary arteries. Over time, this buildup causes the arteries to harden and narrow, reducing blood flow to the heart muscle. As a result, the heart struggles to get the oxygen it needs to maintain normal function. To understand the impact of coronary artery disease, let's first look at how a healthy heart functions. Right atrium. Oxygen-poor blood from the body enters the right atrium through the anterior, upper body, and posterior vena cava, lower body. This blood has already delivered oxygen to the organs and tissues and is now rich in carbon dioxide. Right ventricle. The right atrium contracts, pushing blood through the tricuspid valve into the pulmonary arteries. The tricuspid valve prevents backflow into the atrium. Pulmonary arteries. The right ventricle pumps blood through the pulmonary valve into the pulmonary arteries, which transport the oxygen-poor blood to the lungs. These are the only arteries that carry deoxygenated blood. Capillaries of the lungs. In the lungs, the pulmonary arteries branch into smaller vessels, eventually leading to capillaries. Here, blood undergoes gas exchange. Carbon dioxide is released into the lungs to be exhaled, and oxygen is absorbed into the blood. Pulmonary veins. Now oxygen-rich, the blood travels back to the heart via the pulmonary veins. These are the only veins in the body that carry oxygenated blood. Left atrium. The pulmonary veins empty oxygenated blood into the left atrium. This chamber holds the blood until the next contraction. Left ventricle. The left atrium contracts, pushing blood through the mitral bicuspid valve into the left ventricle. The mitral valve prevents backflow into the left atrium. Aorta. The left ventricle, the strongest chamber, pumps oxygenated blood through the aortic valve into the aorta, the largest artery in the body. This forceful contraction ensures blood reaches all body tissues. Now let's look at how blood flows to the heart. Coronary arteries supply oxygenated blood to the heart muscles. The right coronary artery supplies the right atrium, right ventricle, and the heart's conduction system nodes. The left coronary artery supplies the left atrium and left ventricle. After delivering oxygen, the deoxygenated blood is carried away by veins, which mostly drain into the coronary sinus and then into the right atrium. Now that we understand how a healthy heart functions, let's take a look at what happens when this system is disrupted, a condition known as homeostatic imbalance. What damages the arteries? Coronary artery disease begins when the arteries supplying blood to the heart become damaged, making them vulnerable to plaque buildup. Several factors contribute to this damage. Risk factors. Smoking damages arteries and accelerates plaque buildup. Poor diet and obesity increase cholesterol and strain the heart. Inactivity weakens the cardiovascular system. Chronic stress raises blood pressure and promotes inflammation. Treatment and prevention. Healthy diet and exercise strengthen the heart and improve circulation. Quit smoking to reduce arterial damage. Medications like statins, beta blockers, and antiplatelets help manage symptoms and prevent complications. As plaque buildup worsens, the heart receives less oxygen, leading to ischemia, a condition where the heart muscle struggles due to reduced blood flow. This can cause chest pain, fatigue, and shortness of breath. If an artery becomes completely blocked, it results in a heart attack, myocardial infarction, which can permanently damage the heart muscle. Now let's take a look at current research in fighting against coronary artery disease. As science advances, new medicines develop for treating coronary artery disease more effectively. Researchers are exploring stem cell therapy to repair damaged heart tissue, aiming to regenerate healthy, functional cells where disease has caused irreversible damage, and new technologies allowing earlier, more precise detection of arterial blockages, such as myocardial high-resolution coronary CT angiography, which helps identify even the smallest plaque formations before they become severe. Intravascular ultrasound and optical coherence tomography, which provides full details about plaque composition and stability, enabling for better risk screening and treatment techniques. As research continues to evolve, these advancements bring hope for improved prevention, early detection, and more effective treatments.